Hello, everyone, and welcome to OPJ Hub. I'm so excited you're joining us today. So, today I want to share something very important, and so I want you to share this video to your loved ones and friends so we can all learn together. Okay? So, share this video to your loved ones and friends. So, I want to talk about something that a lot of young people are now asking, and the older people are also finding answers to. And so that's what I'm going to talk about. So I will look at the questions that are coming in and I will answer them. But then you can also share your question in the comment section and I'll be glad to answer it as well. So let's go to the very first question. Okay, so this is for health purposes. This for health education. Okay, so let's go into it. The first question is, Dr. OPJ, what exactly is prostate cancer? Okay, so so prostate cancer is actually in men. We have an organ in the body which is called a gland in the body, which is a prostate gland. Okay, it is located somewhere around the bladder and the urethra area. Okay, it's like a pear-shaped, some round stuff over there, very small. Okay, and it helps in the production of semen, okay, of sperm production because it produces some um, let me use the word, some chemicals, and it helps in the sperm production. Okay, so good. So with that said, now the big question will be, what then is prostate cancer? So prostate cancer is when the cells in the prostate now outgrow themselves in their numbers, in a sense that they are not usually growing in a particular order. That means that there's an abnormal cell growth happening over there. Then we call it a cancer. Okay. So, but then as you age, the cells of these particular organs or this gland begins to multiply and become bigger and bigger. And then when they become bigger and bigger and grow very rapidly, faster than they usually are, then we call it prostate or prostate cancer. Do you get it? So that is basically what it is. And the fact that your prostate has become enlarged, or what we people usually say enlarged prostate, okay, does not necessarily mean that you have a prostate cancer. Do you get the picture? So anytime you hear prostate cancer, they are talking about the stage where the gland has become a cancerous cells. Or when you hear people say enlarged prostate, they mean benign prostate hyperplasia. So the prostate has also become like the cells have become numerous, they have enlarged in size as well. So basically that is it. Okay, I don't know if I've answered your question. You can share it in the comment section if I've answered your question. Let's look at the next question. Okay, so the next question. All right, so the next question says, is prostate cancer the same as enlarged prostate? No, no. As I said earlier on, prostate cancer is not the same as prostate enlargement or what we call the BPH. They are different things, okay? So one is actually a cancerous cells. So the cancers of this of that particular the cells of that particular gland has become cancerous. Whilst the other one, there's the enlarged prostate, the cells there have become enlarged, like their sizes have become enlarged. Do you get the picture? So that's what basically we are talking about as but then it can present with some symptoms like frequency, you urinate frequently, there's some urgency, there's some, nocturia, there's some sometimes when you urinate, you feel like there's still some left inside your bladder. You know, sometimes after you urinate, there will be some dribbling of some of the urine. So all these things may tell you that something is wrong with your prostate, but we can't just conclude that you have a prostate cancer. Do you understand? So that basically that is, so you need to come for further investigation and further questioning to be able to be sure that this one you are having is actually a prostate cancer and not a large prostate. However, some of these things I've mentioned, like weak stream, straining, when you're urinating, you be straining. You feel like the bladder is not fully empty after you have urinated. These things can give us something we call some signs and symptoms that can paint a picture for us that something is wrong with your prostate. Now, the prostate itself can also get inflamed, what we call inflammation can happen around or an infection around the prostate, and that can also present with some of the symptoms I've mentioned. So we need to be really sure that we are not actually dealing with any of this. Do you get it? So prostate cancer is not the same as you know um, a large prostate. Do you get it? Great. So let's ask the next question. Please don't forget to share this video to your loved ones and friends, and I really appreciate you. All right. Okay. So let me just a minute. All right. So the next question is who is at higher risk of prostate cancer? Yes. So prostate cancer does not usually affect child or a child, no. But then with increasing age, it increases your risk. Like you aging, especially men. Disclaimer. Okay. So disclaimer. Prostate cancer, prostate enlargement does not happen in females. Why? Because females do not have prostate. As simple as that. So no one will have prostate cancer or prostate BPH. If you're a female, you will not have that. So, but then you need to know this. So your husband, your male friends, your brothers, and then your uncles can all learn from it. So that's why I want you to share this video to your male friends, your husband, your boyfriend, your uncles, your brothers, your pastors, all of them. Do you get it? So now let's come back to the question. The question is saying that who are those at risk of getting prostate cancer? Now the first thing I'm saying is that age. Increasing age increases your chance of getting a prostate cancer. So I've seen people in their 40s having prostate problem, prostate enlargement leading to cancer. Okay. So once you are a male, once you reach 40 years, I think you should start checking if you have a prostate cancer or something because it increases your risk. Do you get it? Now, another group of people who are also at risk of getting a prostate cancer is if you have a family member who had a prostate cancer, especially if you're a male and your father had a prostate cancer, you are also at the risk of getting a prostate cancer because it increases your risk of you also getting a prostate cancer. So if you know that your father battled with prostate cancer or is having prostate cancer, you're at risk. So as soon as by the time you get to 40 years, you start screening yourself regularly to see if you also have a problem with your prostate. So you can kind of um, take measures quickly as soon as possible so you don't get to the stage where it becomes very difficult to tame. Do you get it? Another group of people who are also at risk is the fact that you are a black person. Yeah. So black Africans or black men actually, or you being an African also increases your risk of you getting a prostate cancer or a prostate disease. Let me put it in that way. Okay. So in our part where I'm Ghana, we have a lot of prostate problems as well. So that's one of the things you should need to know about prostate to those who are at risk. All right. So, but then if you notice any of these, especially you are aging, so one of the things you can do, all right. Thank you so much. So, one of the things you can do is to tell all your male friends by the age of 40, they should start screening for prostates to see if they have a prostate problem. Whether they show any sign or symptoms of difficulty urinating, um, they find it difficult to, or they have some lower abdominal pain, or they have a relative, a father or uncle who has had a prostate disease, or they are an African, a black man, they should screen for prostate here. Like the way we broadcast breast cancer, breast cancer, breast cancer. I want all the ladies to also help us to broadcast prostate cancer for every gentleman to know that prostate cancer, you being a male and you being an African male, and as you age, and if you have a relative, uncle, father, or any male person in your family so close to you who had a prostate cancer or enlarged prostate, you're also at risk of getting that. Do you get it? Excellent. Now let's see the next question. Okay. Okay. So someone is asking, what is the stuff for me to screen to be sure I have a prostate disease? Okay, so yes, yeah. So we have something called the PSA, the prostate specific antigen. Now, this antigen or this prostate specific antigen is produced specifically for the from the prostate, and then we take this to examine. We take some of um, this um, from the prostate and measure it like it's a blood test actually. So we measure it and we are able to make let me just use the word, we're able to know whether you have a BPH or a prostate cancer or probably any prostate other disease, prostate, other prostate related disease. Yes. So it's very important that as at the age group I've mentioned, like from 40 years at least, you need to check your prostate PSA maybe once a year. On your birthdays, you can add it to your schedule that okay, on my birthday, this is not people who are like 20 years, no. I mean people in their early age. So if you have your father, your mother, sorry, your father, your uncle, your brothers who have crossed the age of 40, 45, 50, 60 thereabout, my good friend, you need to be checking the PSA to be sure, especially if they have some symptoms associated with some of these things I've mentioned. All right. Now, someone is asking if my PSA, as you said, is high, does that mean I have cancer? No, 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 no. So it doesn't mean you have cancer. You don't. That mean I have. If it's high, we have a cut-off point we use to make this decision. However, we will take a detailed history of you. All right. Ask you some very important questions. Then ask you about the risk factors of prostate CA or even enlarged prostate. We'll ask of those things in. Probably if I get some time, we'll look at all of that some other time. Then from there, they will ask you some of the complications that they think prostate cancer can bring about. They will ask you all of these things. Then when you are done, they are not, that's not all. Then they will examine you. So they will examine the prostate. They will do what we call a DRA. They will put their hand inside your anus to go and see the surfaces of the prostate and see how it is, whether it's smooth, it's rough, the size, whether it has lost some, you know, all those things. We look at it. Then, you know, we'll do the investigations, we'll do some other labs before we confirm that someone has a prostate disease. Either it's been a prostate cancer or what we call the prostate enlargement. Do you get it? So we don't just go ahead and say, hey, because your PSA is high. But then once it's high, it gives us the reason why we need to go in and find out more about what is happening. Or once it's high, we gather all the information we have already taken from you, the history examination, then we can confidently make a conclusion. Do you get it? So do I really need prostate examination with a finger. Yes, yes. So I mean, you are talking about the DRE, right? Digital rectal examination. Yes. So this one, the health professional can help you do it. You can't do it yourself. They are trained to help you, to do it. As I said, to help you identify the parts that there's a problem from, and then they can make a clinical reasoning, and then from there you can diagnose whether the person's having. So the next question is, at what age should men start checking for prostate? Yeah, there's no actually a universal age for checking, but that I made mention of some few things. Okay, but some argue that from 50, 55, 60, you can start checking. I also argue that from 40 years, especially if you know that your uncle, your father, or your elder brother, or whoever had prostate disease, then you can still check your PSA as well. So someone is saying that if I have prostate cancer, does it mean I will die? No, no, no. Okay, so when you have prostate cancer, that means you are going to die. But rather, what they can do is that it depends on the stage of the cancer, and then the kind of medications and the therapy they can give you that can help prolong your life. So it doesn't mean so when you pronounce someone that is having cancer, it doesn't mean that the person is going to what? Die. Okay, and then also before they consider, and then you have to look at the overall health, the benefits of some of the treatment they will give you, how it will affect your health. Then you'll consider that. So don't worry. Yeah, yeah. So will prostate cancer treatment make me important? Yes, this is an important question you're asking. It can. However, it is not usually the case. Most men who have been treated for prostate cancer do not end up having impotence. Okay, so it can, but it doesn't mean that you are going to have it. So get yourself readily available for treatment. You being treated for the cancer is far better than the impotence. Hey, let me repeat that again. So I'm saying that you being treated for the prostate cancer is better than you living with impotence throughout your life. What am I trying to say? Prostate cancer can cause impotence. That is true. But then it's best you are able to treat the prostate cancer as soon as possible before it complicates to become an impotence. Please, I hope I made myself clear. Yes. So, for you to enjoy life and enjoy well, if you have been diagnosed with prostate cancer, that's not the end of it. There are treatment options for you that you can use that will help you become better. I hope that's clear. Great. Okay, let's look at the next question. Okay, so I'm a young man, can I get prostate cancer? Yes, 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 you can get, but it is not so common in young people. As I said, it's rarely will you see a young male having that. It's usually with increasing age. Okay, so that's one of the things I would like to say. Can herbal medicine prevent prostate cancer? No, 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 no. There is no really reliable herbal medicine that's curing prostate cancer. I know there are some prostate cure and something. Those ones are just a way just to keep. Okay, I don't want to say much about that. I don't know, but then there's no herbal medication that can really do that. Okay. Yeah. So what I want to say is that prostate cancer does not usually present itself with some pain. There may be different stuff that may show, but usually the lower urinary symptoms can be there. There can be some loss of weight, can be some uh, blood in urine, there can be some weight loss, as I said. There can be a lot. Complication of the cancer can go into the lungs, the chest, can go into the stomach, can go into the bones, can cause weakness, joint pains, a whole lot like complicated. So what I would suggest, the earlier we get the root cause of these, or the earlier we are able to identify it, the better we start the treatment, and then the better the outcome. So if you know anyone who is living with prostate cancer or have a prostate cancer, I mean, it has the prostate enlarged, he or she needs to take his medications or see a health professional as soon as possible so they can start the appropriate treatment or management for the person. Don't forget, I am Dr. OPJ Hub, and thank you so much for joining me. See you same time tomorrow. Share this video to your loved ones and friends, especially to your father, your brother, your uncle, your pastors, and every male boyfriend or male friend you have. Until then, take care. Bye.